Good afternoon, everybody. Want to welcome everybody to today's Talk with Doc. It is my absolute honor to have a dear friend of mine join us, Jolene Philo, author and speaker, joining us. And today we are going to be talking on a subject that is just incredibly important for us to be talking about, and one that I think we just don't talk enough about. Sometimes, and that's on PTSD and the family. So, Jolene, welcome. Why don't you first just start off and tell us about yourself? You've written multiple books and just an expert on so many things. But just let everyone know a little bit about you.
Yeah, well, I live in central Iowa with my family, and I grew up in Iowa, actually in Lamar's, the ice cream capital of the world, if any of you are looking for a tasty treat this hot weekend. And I was born into a family where my father had multiple sclerosis, and he was in a wheelchair through the 1960s. He was a relatively young man. We cared for him in our home. And so I grew up with disability. Then in 1982, my husband and I had our first child, a little boy who we found out shortly after birth had a major birth condition that required immediate surgery if he was going to live. We were in South Dakota then. He was born in Spearfish, and he was sent to Omaha to the University Hospital there for that surgery. It was the closest place where they could do it. And he had some really rough years. He had about 7 surgeries by the time he was 5, another one at 15, lots and lots of procedures in between. But other than that, he seemed like just, your average happy-go-lucky kid. He did well in school. Everybody liked him. I was a school teacher, and I taught school for 25 years. My husband eventually became a nurse, which is something he still does. When our son was in about 7th or 8th grade, we started noticing some behavior things. Like we had 2 kids. There was this high-achieving son who just did everything well. And then there was this kid that just, made stupid decisions and risky behavior and all that kind of thing. And we were beginning to think something was going on, but we couldn't. This was like in the mid to late 90s, and we couldn't really get any buy-in from anybody because he did so well in so many other areas. But he ran away from home the summer before his senior year in high school. And that was the beginning of a pattern of running that lasted for about 6 or 7 years, maybe a little longer. And eventually, when he was 26 in 2008, he called us and said, can you help me? I don't know what's wrong, but I cannot get married. I could never get a job and hold it. I can't do anything until I figure this out. And truly, by the grace of God, he was living in West Virginia then. And through the grace of God and some family members who were mental health care therapists, we found a clinic in Morgantown, West Virginia that worked with people who had post-traumatic stress disorder. And he was able to do the admission forms online, and they were able to let him know while we were still on the way to get him that they believed he had post-traumatic stress disorder that had been caused by all that early invasive medical treatment. Wow. Yeah, and the little piece in here that'll curl people's toes is we didn't find out till much later. But in 1982, if a newborn had surgery, that baby was not given any pain medication. They were given a paralytic, so they held still, but then the surgery was completely without pain meds. And he had major scars from under his armpit to his spine and some other ones. And there were no drugs during the recovery. We knew that because they kept telling us babies don't feel pain. Babies don't feel pain. That's, of course, been disproven now, and that practice is no longer done. It ended in 1986. I don't know if you can hear my niece or my granddaughter who didn't get a nap out there kind of wailing a little bit. That's the sound if you hear it. So anyway, okay, back to our son. The clinic was able then to get him in the next week, and he went through a week of intensive outpatient treatment that changed his life. He was able to access with them and work through the memories that he had, the nonverbal memories that he had, and was able to process them, give them a narrative, and kind of refile them in his brain so that he could, when he was triggered by some sort of memory, he could talk to himself about it and assure himself that he was okay. He is now married. He has 2 children. He has a farm in Wisconsin. And after we're done with this interview, we're heading out to go visit him and our grandkids this weekend. And he's doing very well. Well, our son-in-law, a few years after our son went through treatment, went to the same clinic for treatment because he had suffered a lot of abuse and seen a terrible accident when he was very young. And that time, my daughter and future son-in-law then invited me to go with them. Well, I took everything I could, and I had questions ready, and I arranged to interview everyone on the staff of that clinic about PTSD in kids, because by this time I was like, how come more people don't know about this? Somebody needs to write about it. My sister, who's a clinician, said, but everybody knows about that. I said, well, you in the mental health care community think everybody knows about it, but they don't. And what is out there isn't written to be accessible for us lay people. So in 2015, my book, Does My Child Have PTSD? What to Do When Your Child is Hurting from the Inside Out, came out through Familius Publishing. And it is just kind of a translation of all that's out there already, the research, the treatments, and all that kind of thing. And it's written so that teachers, other educators, pastors, parents, all of us who care about children can read it and help our kids, help us see what our kids are going through and then seek a professional treatment for them. So Absolutely. There you go.
Yeah. And so first, let me just tell everyone, if you don't have this book, you need to get it. It really is a fabulous book and truly is written for any lay person to be able to read and very, very easy read with it. And really helps put things in terms where you're going to be able to understand it and just really opens your eyes with it. So fantastic. And it may even help you realize that you may even have a bit of PTSD, which really, is not uncommon. I think, PTSD is rampant throughout families with disabilities, just because of life and how things go. But with that, how prevalent is PTSD in children?
Well, there are no hard statistics about that. You can read some things that say maybe 7% of kids or 20% of kids or 25%, but there are no hard and fast national statistics on that, which is a real problem. But I think if you look at like the prevalence of children who maybe are in foster care, which by its very nature has to be a traumatic event, because a child is taken away from their family and they're taken away because there were traumatic things going on beforehand. When you think of all the children that have surgery, and then you look at kids, who live in war zones, that's a traumatic environment. Also, there's even a lot of research showing that children who grow up in an atmosphere of racial injustice develop PTSD and a lot of other things. I don't think it's a far stretch to say that at least a quarter of our children are dealing with some sort of trauma and PTSD, and probably far higher. I teach a class for educators in the summer, and they're like, oh yeah, this is way more than 1 out of 4 of our children as they look at them.
Yeah, and I'd be willing to say that even that 1 out of 4, that doesn't mean that 25% are being treated and taken care of that, because I think that's an even smaller piece of the pie. But yeah, it's definitely here and that. So next kind of thing that kind of goes into there, you're talking about trauma, and that can definitely be a piece with it, but I think that can be confusing sometimes. Is there a difference between trauma and PTSD, and are they different? Are they the same? How are they similar? Can you go into that?
Sure, they're related. Let's put it that way. I mean, we all experience trauma all of us from childhood on. There are things that happen that are scary, that are painful, that we don't understand. And so we all go through traumatic events, but we've all seen it too, that some children seem to bounce back from that and move on without any issues. And some children just, it seems to stay with them and even worsen. So we all suffer these traumas. But if the original traumatic event, whether it is something like being in a tornado or a car accident, a single thing, or suffering abuse, or being bullied, or having your parents get a divorce, or the death of a significant loved one, or a surgery, whatever it is, the child is going to exhibit some symptoms after that as a part of being scared by it. You know, they may have nightmares. They may have trouble getting to sleep. They may want you to be with them a lot more than normal, kind of that separation anxiety thing. They may be irritable or anxious or fussy, or they may try to avoid similar kinds of situations. And that's natural. But over time, as the parents provide, or the caregiver provides a secure environment for the child and helps them understand they're safe, those symptoms should gradually drop off, as they do for all of us that go through something like that. If the symptoms continue 3 months beyond the original event and they don't seem to be lessening, then you can go to a mental health care therapist, and the child might receive a diagnosis of post-traumatic stress disorder. And what that means is that traumatic event has not been processed. It's stuck somewhere in the brain and the child needs some help to process it, to get rid of the energy and the stress hormones that come along with those events so they can move on with their life. I like to compare it to from a skinned knee, which is trauma, to an infected wound, which is PTSD. That skin knee will hurt for a while, but if somebody helps you clean it out, picks out the little bits of gravel underneath your skin, bandages it every day, lets it get some air, make sure it has antibiotic cream, it's going to go away. Now, it might hurt a little bit, and it might be rough for a while, but eventually you'll hardly even remember it.
Right.
If that care isn't given to it, it can get infected, and it can lead to systemic issues throughout the body. An infection can, in worst case scenarios, you can get really, really sick, have to amputate a foot, whatever. And that's kind of what PTSD is like. It's like almost your brain gets infected. That mental wound is festering in there. And the longer it's there and festering and not dealt with, the more likely it is to affect your behaviors, your relationships, and the way you're able to live life. And so that's the difference.
That's a great explanation. Really helps kind of putting it together there, and love the thought with the knee there. That really helps separate it too. So then let's just jump right into PTSD then. What are some of the causes of it? Obviously trauma, but what are some specific causes of PTSD in kids?
There are so many causes, and my favorite way to look at this is to remember that we have to think like children when we look at what some of these things are that cause trauma. We have to think of when we were children. We were littler, our brains weren't as developed, we were much more vulnerable, we were much more dependent on other people to meet our basic needs. I think of my granddaughter, who won't stay in her high chair to eat unless we, hook her in, lock her little seatbelt.
Right.
Well, then she's dependent for us to get her out. She doesn't have any control over that. And that's what life is like for children. They don't have control over these things. So anything that we can just take into stride and deal with ourselves can be traumatic for kids. One of my favorite definitions of what can cause trauma is it's the scary, yucky, painful things in childhood. So it can be a lot of things. It can be if you're not very athletic and you go to school and you always get chosen last to be on a team. That's emotionally painful. It can be things like a divorce in the family. Moving, believe it or not, can be a very traumatic event because children have no control, and all of a sudden their life has totally changed from where their toys are to what their environment looks like when they go out the door in the morning, to their teacher, to their friends. Everything has changed. Another one I think that gets missed a lot is adoption. And I am a proponent of adoption. I think it's wonderful. There are children who need families and families willing to have children, but we have to recognize that within that adoption, a child has been taken away from the birth mother whose rhythms that baby was synced with for 9 months. And the sound of that parent's voice, the beat of the heart, the rise and fall of their emotions, all of that. And so that separation, and there's research that shows at birth, a newborn recognizes the mother's voice and will turn to the mother. Right. So when that bond is broken, that is a trauma. A difficult birth, by the way, can also be a trauma. So if we're dealing with those adoption issues, we have to be aware of that, and we need to really be reading the child and be ready to deal with some of those issues as they're able to when they get a little older. There are also in utero things that can cause trauma. There's been a lot of research done that shows that mothers who are going through a trauma when they're pregnant, their babies are born with higher stress hormone cortisol levels in their own blood, which means that they're going to be a little more at risk for developing trauma and PTSD in their own life.
Yeah.
That's a brief overview.
Yeah, no, that's great. And, I'm sure, it's an unending list. It can go on forever, but that's kind of a good little bit of an overview there. But that then kind of leads into the next part of that. Are there certain factors then that might actually place a child at a great risk of actually developing PTSD?
There are. And again, this goes into that. How come some kids bounce back and some kids don't? Well, the first risk factor is a prior history of trauma. How much trauma has the child had in their life before this event? Because kids bounce back, but after you've had to bounce back so many times, it gets harder and harder. And there's a lot more old baggage that you're carrying along, so the bounce doesn't go quite as high. So the more trauma a child has experienced in their life, the more likely they are to develop PTSD. The nature of the traumatic event is big. So a single event like an accident or a natural disaster is less likely to cause PTSD eventually than is, say, anything like abuse perpetrated by a person you are close to, a person who's supposed to be keeping a child secure. The reaction, here's a great one, and I think this is a takeaway for parents right here. The reaction of the caregiver when the event happens. If that caregiver can remain calm and provide security of some sort for the child through the event or immediately after, that child is not going to develop PTSD as likely as a child whose parent just kind of lost it. Because remember, we as the adults, we are the safe space for our kids. And if we're, think of like the time when you were a kid that you saw your parents cry. I mean, that's just like, what? My parents never cry. So if a parent loses it during an event, the child is more likely to develop PTSD. I already mentioned the relationship of the child to the perpetrator. If it's something like emotional, physical, sexual, or verbal abuse, the closer the child is to the perpetrator, the more likely, the higher the risk factor. The child's temperament has a lot to do with it. We all know if you have more than one child, you know that they are not the same. Even if your parenting is just the same, they respond differently. So children who have are maybe seem more nervous at birth, or more, I shouldn't say nervous, sensitive to a parent's emotions, sensitive to the environment around them, whether it's sound or light or anything. Those children that seem more sensitive are more likely to develop PTSD because all those senses are more overwhelming to them. Another one is the age of the child at the trauma. Now, this is the one that I think we need to, our standard understanding, we need to flip over. Because, you hear about people who adopt maybe a sibling group, and they say, well, the two older ones may have a little bit of trouble, but the younger one won't remember anything, so that child will be okay. It's actually the opposite. that the younger the child, the more likely they are to develop PTSD, because so many of their memories when that event happens are nonverbal. They have no words to express that, and their memories come back as wordless, kind of ominous sensations. So the age of the child is important. And then finally, if the parent, I alluded to this before, if the parent has a history of PTSD, that increases risks for children to develop it. There are some genetic factors. There is a marker, and a psychiatrist explained this all to me and told me the name of the gene, and I'm like, okay, well, it has to do with genetics. But there is a marker on a few of the chromosomes that indicate a child is more likely to develop it. And then there is the idea of epigenetics, which is a new field where they're finding that the history of parents and grandparents can actually change the coding of our genes. And so, for example, one is they studied families who didn't have enough to eat in the Great Depression, and that affected the appetites of future generations to want to eat more, because they were still, their parents' genes had changed and their grandparents' genes had changed, and those had been passed down. So the same thing can happen with trauma in children. That can be passed down that way.
Yeah. I just want to kind of back up on the age part and just add another part with that, to help people kind of understand exactly what you were saying, where the younger child is actually a little bit higher risk.
Yes.
One of the other reasons for it, like you're saying, nonverbal, but the other big reason is that's when there's so much brain development going on. And so they're laying down all this brain development and creating, the brain's maturing. And if that brain development is going on and laying down all these pathways and everything with that trauma and all that process going on, basically what you've now done is you've permanently placed that into the brain. And so because of that, that child's going to have a harder time, with that than the older child whose brain is already more mature with it.
Right.
So that's a little bit of the biology behind that, why that's a myth out there. Oh, don't worry about the younger child. They'll deal with it. Well, that's not necessarily true, because they may, but there's also a higher risk because the way the brain develops, that it could actually cause them to have more problems through the future with the PTSD and have to work with that.
Yeah. And so then, you've got so much to undo and, unravel in them, because it's like this thing happens to them. And so they lay down in their brain that, okay, if this happens, if I see this, danger. So I need to respond like that. And so it's just like, we think it's part of their personality, but it's actually learned behavior to keep them for survival. They're trying to survive.
Pavlov's dog, they hear the bell and react.
Mm-hmm.
That's exactly, it's a learned behavior that they've had from it. Absolutely. So that's fabulous. So let's kind of go then from that. We've talked about, what might factor it. But what might be some symptoms? I think we may have some people out there today who are going, I wonder, does my child have PTSD? What might be some symptoms that they might see in their child?
Sure. And there's a few things we need to make sure everybody knows up front before we go into those. And that is that the symptoms in an infant to 3-year-old are going to be different from those in a 4-year-old to an 8-year-old, or an 8-year-old to a teenager, and then from a adolescence up to adulthood. That's a broad spectrum of development. And so the symptoms are going to look very different at different ages. Now, in the DSM, which is the Diagnostic and Statistics Manual that is used for determining if someone has a mental illness, it's a diagnostic tool, and it is the tool, by the way, that is recognized by insurance companies. So if you want to get insurance to pay for anything, it has to be a diagnosis from the DSM, which is why if your child is exhibiting behaviors, you want to go and get a diagnosis from someone from that book so that hopefully you can get treatment. But within that book, they have 3 categories of symptoms of PTSD in children. And those are called intrusive. I'm blanking, and my notes are not good enough. There's intrusive, and there's avoidant, and there's arousal. There we go. So the intrusive symptoms, if you think of those, that's when a memory of a traumatic event is triggered. It intrudes upon your brain, and it kind of pushes away the present and goes back into the past. It intrudes. So it can be things in children. It can look like daydreaming, because they're at school and something triggered a memory and all of a sudden they're reliving that in their mind. That's a big one for kids of all ages. It can be nightmares and other sleep issues. That is huge for children of all ages and adults, because you can kind of stay on alert all during the day and be watching for danger, but when you try to go to sleep, those memories are going to kind of come in when you're least expecting it and wake you up with a nightmare or keep you from falling asleep, whatever it is. For very little children, it can mean that they're very irritable and anxious and they startle easily. And as kids get older, it's kind of that same thing, only they're just grumpy, or they're never happy, or they're anxious and they're whiny and all that kind of thing. So then when you go on to arousal symptoms, that is the memory has intruded and you very quickly move. Go ahead.
Real quick, Jolene, I think we actually have this. Let me screen share, okay, and we can share a lot of this so people can see it as you go along. But you go ahead, keep talking about it. I just want to let you know, I'm going to screen share so we can see this, and let me see if I can actually get this to.
Oh, there they are. Okay. Awesome. So a few other then of these intrusive symptoms. Whoops, you have it now.
Yeah, we'll get there.
There. Back one. Go back there. One. Okay, some other things for the intrusive symptoms then are they become very distressed emotionally when the event occurs. Here's a big one. Repetitive recreation of the event in play for younger children. So I have a friend who adopted a child from a Ukrainian orphanage, and she asked me once, should I be concerned because my little girl, when she plays with her dolls, tells her dolls, if you don't behave, I'm going to tie you down.
Oh, wow.
Yeah, repetitive recreation of the event in play. Where could she have gotten that except from when she was in the orphanage? As kids get older, that's more of they retell it in conversation. They tell you the same story over and over of this event. And you're like, would you please get over it? But they can't because they're stuck in it. And then as kids get even older, poor school or work performance because those memories are always intruding. And then they make them not do well in school. They aren't paying attention or paying attention to their work. And so their work suffers. Okay, let's go on to the next one then, arousal symptoms. So this is the easy startle. And this is the idea of the symptom or the memory has intruded and now you're on high alert. It's sometimes called hyperarousal or hypervigilant symptoms. These kids are excessively fussy. Babies often have poor weight, low weight, digestive issues, and they're anxious and fearful. Now, why would they have poor appetite and have all this food stuff? What happens when you're nervous or worried about something? What happens to your stomach? It ties up in knots and you can't eat. And these poor little kids are feeling like that all the time. And so they can't eat enough to grow like they need to, which of course then leads into a whole lot of other stuff. They have regressive behaviors and severe separation anxiety. Regressive behavior means they go back to a behavior that was appropriate when they were younger, but no longer is. So they weren't wetting the bed, now they are. They didn't need their sippy cup or bottle, now they do. They didn't suck their thumb, now they do. They go back to baby talk. All sorts of things that are regressive. And then they don't want to be away from their safe person. That's an arousal symptom, a way to stay safe. They complain about a lot of physical ailments and aches and pains, and they get really overly upset about bumps and bruises where it should be nothing. But for them, there was something that happened once, and when it hurt like that, it was terrible. And so they go straight to that. As they get older, they can become aggressive, impulsive, risky behaviors like drug use, or alcohol or sexual promiscuity or driving too fast, those kinds of things. They can start to act out in social situations or be verbally abusive because they're on high alert, and the minute something happens, they're going to respond. They aren't going to wait and think. And then this one I think is very interesting, an impending sense of doom. So they're constantly kind of looking over their shoulder, waiting for the next terrible thing to happen, because something bad always does. After my son went through treatment, one of the things he said to me was, "Mom, for the first time in my life, I'm not looking over my shoulder, waiting for them to take me into the operating room."
Wow.
That was that impending sense of doom.
Wow.
So their kids also, they can't see their future. They can't see a future because they think they'll be dead by then, because something terrible is going to happen. Okay, and the next one, the last category here, is avoidance symptoms. So you've had the intrusion into your present and you're reliving the past. Now you're on high alert, and one of the best ways to deal with danger, perceived danger, is to get out of there. So avoidance symptoms. You're going to try and avoid the trauma. You avoid people associated with the trauma. Like my son, by age 6 months, if somebody came in the door with a white coat and a stethoscope, he was climbing over our shoulders. He knew something was going to hurt. Again, there can be fear, anxiety, irritability, because they just don't want to be there. This is scary. They complain of ailments in order to avoid something. They don't want to go to school. They don't want to go to ball practice, whatever is the trigger for them. They can withdraw and act emotionally numb. And what they're actually doing is every time the memories and emotions flood in, they push them down, because those emotions just remind them of that terrible event. And if they can not have the emotion, maybe they can forget about what happened. So they often can't explain their emotions either as they get older, because they've always suppressed them. They may refuse to go to the place of the original trauma. They don't want to talk about it. And sometimes as they get older, they may even deny that it ever happened. There can be substance abuse again, which when you think of that, that's a way to avoid the emotions. Self-harming behaviors like cutting. I mentioned denying emotions, and then a lack of self-confidence. They appear not to be confident, but it's not that. They just don't want to be there. They want to be somewhere else. And maybe if they're in a place that doesn't feel threatening, they have plenty of confidence in those situations. I think of kids who love to be in plays and perform, and some of those kids have some pretty significant PTSD issues, but when they're on stage, they've got a routine that they've practiced, and they know when the next person's going to come in and what's going to be said. And so that's a really safe place, and they seem very confident there. But when they're somewhere where they can't control it, they have no confidence.
Wow.
So those are some of the symptoms. And in my book, I break those out into all of the different age groups, so you can get a much better idea of what to look at.
Got them
yeah.
here.
Mm-hmm. They're there. My old eyes have trouble reading that, but there are symptoms. Are these going to be available also?
Yeah, I will share this when we post.
Okay. Yeah. I think rather than trying to go through them all, but just note that if it's preschool and very young children, you're going to see a lot more behaviors, and but they won't be as verbal. You'll see actions more than words. As kids get older, you'll see the talking about it, the arguing, those kinds of things, the verbal abuse that littler children aren't able to do. And as kids get older into their teen years, then their behaviors are much more similar to adult behaviors. So what we think of as post-PTSD symptoms in a soldier or whatever, we may see that in an adolescent child.
Yeah. A couple that I'll just mention that kind of jump out for me on the preschool age one here is, one, they're not developing to the next growth stage. Mm-hmm. And so that always needs to be a warning sign for us. And then the other one, and this just isn't typical for a typical preschool child, they ask questions about death. And it's not just a one-time question. This is kind of a repeated, question about death. And so, should be things that really, spike your interest and concern with it. That again, just aren't normal for a preschool child.
I've seen that so often in children, especially children who go through a lot of medical things. Our son was probably 3 when he asked us, when somebody dies, where does the rest of them go? And I was like, what do you mean? And he said, that part that comes out of them. And I'm sure he was talking about the spirit. Well, where did that come from?
Right.
There may have been an experience when he was having one of his surgeries where he felt that. And I had a friend who had a daughter who had leukemia when she was young, and the daughter is fine now, but she also would say those kinds of things.
Yeah.
So, yeah.
And then we got the elementary ones here, and again, we'll share this when we post the video with everything. But a lot that we had talked about, the difficulty sleeping, easily started, and having numbness is an interesting one.
Yeah, that emotional numbness.
It's just it's the emotional numbness to everything.
Mm-hmm.
And then the middle and high school kids, they've got a little different there too. And again, you'll see that they, again, like Jolene had said, the whole part with the sexually active and using substance abuse, you start seeing really prevalent there with it. So kind of then with all this, then with that, how is childhood PTSD commonly misdiagnosed?
Yeah.
Then.
And I think we're getting better with that as awareness grows, but it's still not where we need to be. And one thing I would say, if you notice any of these symptoms in a child in your care who has a trauma history, I would meet with a therapist who has trauma training, because there's probably something going on. And especially all across the board, you see those sleep issues. So if you have a child with a known trauma history and has always had sleep issues, again, I would be going to see a therapist. So trauma can be misdiagnosed for a number of reasons. And that can be the age of the child. The younger they are, the harder it is to diagnose, because the child can't tell you much. They don't remember in words what happened to them. Regression can cause it, because a lot of children regress to a previous developmental state. A lot of them even can lose language, so they don't have the language anymore to describe what happened to them. And if they're young enough, they don't have the language anyway to describe what happened to them. And if it's something that we don't talk about ever, how are they ever going to know how to talk about it? They can have memory problems because they're trying to press down and avoid those memories. They want to avoid talking about it. So if there's a therapist trying to get them to talk about how they're feeling, they don't even want to talk about it. They may deny it. There can be inaccurate reporting. And we think of this especially in issues where the caregiver is perpetrating the abuse. They are probably not going to report what they're doing to their child. And then if the child has been put into foster care, the parents only know what the foster care system has told them. They don't have a complete history of the child. And the same can be true in adoption situations. You really don't know what's happened. There can be very confusing symptoms, because very often PTSD is a comorbid diagnosis, which means there are other mental illnesses in with it. There can be a mood disorder thing. There could be, if they're a child that went through severe abuse as a child, whether it was just neglect, like we think of orphanages in the 80s and 90s in Eastern Europe, that child may have RAD, which is reactive attachment disorder. So if you've got that diagnosis and PTSD, they're going to clash, and it's hard to know what's what. Though there's a lot of thinking now that actually RAD is a form of PTSD, because the child just kind of closed down to protect themselves during this traumatic withholding of what they needed, and then their brains just can't even develop. They don't develop as they should because they aren't stimulated as they should be. So that goes along with the multiple health disorders. Oh, back on the confusing symptoms. The thing is, PTSD is a real copycat. So it could look like It could look like RAD. It can often look like ADHD, attention deficit disorder, because the child's doing this and then something triggers a memory, so they have to get away and they start doing this. And they do that a little bit and then they move on and move on. Well, that looks a lot like attention deficit disorder.
Absolutely.
But yeah, it could be PTSD. It also could look like a mood disorder, because what happens when a child has PTSD is every time there's that traumatic event, a piece of the child gets stuck at the age it happened. So could be a baby trauma person and one at age 2 and one at age 5. And when the memory of the event that happened at a certain age is triggered, they start acting like they did at that age. And they start reacting like they did to the trauma. So if you're 15 and you're triggered by something that happened when you were 2, and you start reacting like you did when you were 2 to the trauma, it's like a whole different person. And that can look like a mood disorder when actually it is PTSD. Right. So those can be reasons why it's misdiagnosed. But if you know that a child has a trauma history, you really need to advocate that. Now, let's look at the PTSD symptoms some more. Let's see what we can do.
Right. So what can parents do to actually prevent PTSD in their children?
There are a lot of things that they can do. First of all, control your own emotions when there are traumatic events, or when you talk about past things. You know, the more you talk about that same event over and over in front of the child, if they haven't completely processed it, you could be helping them relive it. So think about who you are and what you need to do. You need to stay calm. You need to put, at least for a while, put your own emotions on hold and deal with your child. And then when you've helped your child process it, then you need to go back and deal with your own emotions so that you can stay healthy. But for a while, you're going to have to focus on the child. So the main thing is be calm and nurturing and provide security for your child. There is research that shows very young children who go through very traumatic events, even repeated traumatic events, can recover from that very well if they have a secure, calm, and loving primary caregiver. I don't think that can be emphasized enough. And I think that even carries on, like, if you're the medical health care provider, if that person can provide that kind of a atmosphere for the child, that's going to make a difference. Our son had one of his doctors when he was very young who just was so good with him, and he had to do awful things to our son when our son was awake. You know, he had to pull tubes down his throat, which was very scary. But Alan, by the time he was 2, called that man his buddy doctor, because he just loved him so much and he was so good with him and always hugged him and talked to him. So those things make a difference for teachers also. So if you're a parent, look for those kinds of people to put into your child's world. You want the teacher that's going to be nurturing and calm. You want the doctor that's going to look at your child as a human being and care about them as a person and not just a patient. So that can be very good. If a child has to go in for some kind of a medical procedure, whether it is in the hospital or the doctor's office or even dental work, you need to be with the child. First of all, advocate for the child being put under, you know, if it's scary or if it's going to be difficult. And then you need to advocate to be with your child until they go under. So they always feel like they have you with them. And then you need to say, and I want to be with my child in recovery before he or she wakes up, because then the child has someone with them. You could also advocate to have someone maybe rub your child's arm throughout the procedure to kind of keep them grounded, so they know they're in the world and have that sense of calm with them. Allow people to do nothing to your child when they are terrified, wherever that may be. So if your child is scared, something happens at the grocery store and they have a meltdown and they're scared, don't let anybody touch them until they're calm again. You are the person in charge of them. You can also, like, if your child's going to have any kind of thing that could be scary to them, whether it's going to a new school or going to a new healthcare provider, take them for a visit before the event. Let them meet the people, let them see the place, let them ask their questions. All those kinds of things can prevent trauma, and then be looking for any signs of trauma after whatever the event is. And if you see anything, you need to sit with them and provide for them the security they need. There's an excellent book called Trauma Proofing Your Child, and it's written by Dr. Peter Levine and Maggie Klein. And it has a section, it has many exercises that you can do with kids of different ages to help them process trauma, even at home. And it has something called Trauma First Aid, and it's a series of several steps. And I talk about this in my book too, and give them credit for it. But it's a series of steps of what you do to help your child after a trauma, or any time to help them dispel those emotions. So that can prevent the trauma that they may suffer from turning into PTSD. And then, of course, if you think if you feel the child isn't recovering soon enough, find a therapist and have someone work with them.
So then, going with that, what are some effective therapies that can children be treated for PTSD?
You know, there are more and more. There have been more that have come into being since my book came out, which is wonderful. We're kind of in that age with mental health care treatment that we were in with modern medicine back in the 20s and 30s, when they were discovering penicillin and, drugs that could, pain drugs and all those kinds of things that have made such advances. And we're doing that with mental health care therapy. So the main thing I think any parent needs to remember is that you want to find treatments that help the child access nonverbal memories. Because all your memories when you're going through a trauma, especially age 3 and younger, before you have much language, but even as we get older, when we go through a trauma, our brain goes back to that reptilian, very basic memory in the base of our brain, and there are no words for that. So you have to find a way to access those memories, those nonverbal memories, and help put a narrative to them, get them so they are worded. So that's why a good therapy can begin as early as age 3. The child has to have enough memory or enough vocabulary for that. Or if you're dealing with a person older, whose developmental age is at least 3, and they have a 3-year-old's vocabulary. So if you've got someone with developmental disabilities or whatever, they can also be treated. The therapy that you want to look for then needs to make that traumatized part of the person feel safe. So you're never looking for a therapy where they relive the traumatic event, because all that does is traumatizes a child again. So they kind of have to go around, around the side to get to those memories. So things like hypnosis and guided imagery and play therapy can be good ways to start looking at those memories and talking about them while the rest of the brain remains calm. Equine, this is why pet therapy and horse therapy and some of those other things work well, because they deal more with the your senses and your emotions than words. Another one that I have is becoming much more available, and I recommend a lot, is eye movement desensitization reprocessing, known as EMDR. And they really don't know why it works, but again, it's a way of getting you to focus on one thing, in this case, moving your eyes back and forth, and doing that while you and the therapist are at the same time talking over what has happened. And somehow they think what happens when you're doing that is that it helps the memories that are stuck in the right side of the brain cross the corpus callosum into the left side of the brain and repair the pathways that get broken by trauma in that brain. And so those are some good ones. Biofeedback can be effective. There is a book out by a doctor named Dr. Basil van der Kolk, and the book is called The Body Keeps the Score. And it came out in 2015, and he has been working on trauma in kids since the 60s. And he's done tons of research. And he goes through every treatment out there, what it's like, what it does, how it works, and the research behind it, and his opinion on it. And if anybody is looking for treatment information, that is the book to go to, because he has the knowledge and the background to explain it much better than I can.
Yeah. Great. And then, so going with that, how can parents be affected by raising a traumatized child, and are they at risk themselves of developing PTSD?
Just I'll use myself as an example. We had our first child, and 8 hours after he was born, the doctor came in and said, there's something wrong. We need to send him 750 miles away. How is that not going to be traumatic to a new mom and a new dad? And the mom, of course, has all these hormones racing and, that biological need to hold the baby. So that's traumatic. You see a child go through something that you want to protect them from, whatever it is, and I hear that from parents all the time. I'm such a bad parent because I allowed this to happen. Well, you didn't allow it. In 99% of the cases, you didn't allow it. But we feel as parents a lot of guilt over those events happening, about our children not having the life or the childhood we hoped they would. We feel a lot of grief because we and our children have lost what we hoped for them. And all of that gets mashed up in the middle of having to care for and parent in a way we never expected. And even with a child who's typical, there is such a huge learning curve, and it's hard, and you put your own needs and your own emotions to the side and you care for the child. Well, when you're doing that with a child who has whatever their special need is, there isn't as much advice out there. You're kind of figuring it out even more. You feel isolated. So all that can lead to trauma in parents. And then they don't want to say anything because they're fearful that people will perceive them as a bad parent, that they don't love their child enough. And there are people who will tell parents that, not those within the special needs community, because we get it, but there are those who don't understand what's going on and say hurtful things. And so then we don't get the help we need, and you end up like I did, and then you get busy with life and you move on and you think everything's okay, and you end up like I did when I was 32, when my son was having a difficult time again. And it's like you're just broken again because you can't fix your child again. And I thankfully had a sister who said, I think you need some help. And she helped me find a therapist who just helped me process that grief and the traumatic memories. And if we're going to parent well, we need to be as healthy as we can be. So if you feel that you need help, you need to get it, because your child needs you to be as strong as you can be, as long as you can be.
Yeah, and you'll never be able to do your best job taking care of your child if you can't do the best for yourself, get yourself taken care of.
Exactly.
So it's vital, for you to be able to help your child to help yourself out too.
It is. And if we want to, also the other piece of it is that we know in many cases, our children will outlive us in most cases. And if our child has special needs, we've got to prepare for their future after we're gone. And if we're dealing with our own issues and we can't even look at the future, we aren't going to do what they need for their whole life. So we really have to deal with that. And we really have to just be willing to take that step. And you know what? Once you get into it, it's not nearly as scary as you think it's going to be. It's very freeing and relieving to get rid of that emotional baggage and move on.
So let's say, hopefully today, one of our parents maybe out there has listened to this and they're going, you know what? I suspect my child may have experienced trauma, or they may have PTSD. What should they do next? What's their next step?
Finding a therapist, and finding a good one. Now, and that can be tricky depending on where you live. On my website, which is differentdream.com, if you go to my website and you type in the search bar, how to find a therapist, I have a couple articles, one for adults and one for children, that explains the steps of how you can find a therapist wherever you are in the United States. I'm not sure how it will work in other countries, but somehow there's got to be, and this one begins with going to Psychology Today's website and looking at their locator and finding a list of therapists in your zip code area. And then it goes on and gives you some things to be looking for, what to screen for, and how to proceed. Right. And the main thing is you want to look for someone who works with children and has specialized trauma training, and that do some of those therapies that are not all talk-based. If they say that they're going to do cognitive behavioral therapy, that can be an effective therapy for some things, but I don't think it's the best thing for trauma because it's a talk-based therapy and you aren't able to access those nonverbal memories. Also, if anybody has any questions, on my website, differentdream.com, just hit the contact me thing and send me an email, and I can either respond to you by email. I would be glad to talk to you on the phone a little bit to help you. And then just get educated. So if you get my book, Does My Child Have PTSD? It has lists and lists of other resources for you to look into to help you find what you need to help your child.
Right. Yeah, and I actually don't have my copy of the book because I actually gave it away to a family that needed it. I did the right thing with that. But if I remember right, in the back of the book, one of the things I loved with it was you had prayers in there. Can you just talk a little bit on that real quick?
That is actually in a different book called A Different Dream for My Child. Or no, Different Dream Parenting. Yes. Different Dream Parenting has prayers, 30 days worth of prayers for your child, 30 days worth of prayers for educators, 30 for medical professionals, I think 30 for grieving families, so a month worth of prayers. If you don't mind the screen being blank a second, I'll just get that book and hold it up so people know what it looks like. Yeah.
So again, Jolene's written multiple books. All of them have been fantastic. I recommend everybody, go out and grab them. But
I do too, but it's nice to have you say that, Doc. So this is the one with the prayers in the back, and I'll even, so this one is called 30 Prayers of Dependence for us as parents, of how we can depend upon God and so forth. And there's 30, I think the last one is 30 Days of Prayers. Let's see it. I think 30 Prayers for Raising a Survivor is maybe the last one.
Good.
And then this is also something that a parent gave me who had a child who was dealing with cancer. And these are 30 ways to pray for your child's character. And these are all things that she came up with and Bible verses to go with them. So,
great.
Yeah.
Well, I want to make sure we get this one. We got a great question that came in from one of our viewers. She said, I'm an adult who grew up with 2 siblings with special needs. As an adult, I'm going through therapy for complex PTSD. What is your take on special needs siblings experiencing trauma? So we've talked about the kids, we've talked about the parents. Now let's talk on the siblings.
Oh, I think, you're growing up in an unusual situation. If this person had 2 siblings, the parent's attention was probably often on those children with the special needs. So maybe the typical siblings don't get, when they go through an event, they don't get all of that nurturing and time with their parents to process it. And depending on the siblings' behavior, the child with special needs behavior, if they're aggressive or anything like that, physically aggressive, that's hard. Or if they're even, embarrassing in public at a certain age, even, going out with my dad when I was a kid in the 60s, there were not a lot of people in wheelchairs. And I was so embarrassed all the time because people would look at us, and that can be, for a child, that can be traumatic. And I think as kids, as those siblings, just like my brother and sister and I, when we were young, we were asked to do a lot of things that were not age appropriate to help care for our dad. We were given a lot of responsibility that children really shouldn't have. And I'm not saying that's all bad. It can be okay to do that sometimes, but siblings have to have some space in which to just be kids and to enjoy a childhood.
Right.
And so I can very much see that this person could be going through some trauma. And I'm really glad that she's going through treatment. And when she talks about complex childhood trauma, what she's talking about is that repeated trauma when it goes on and kind of becomes part of the fabric of your very environment. And so, yeah, I can see, and I'm, like I said, I'm really glad she's getting the treatment, or he.
Absolutely. Yeah. So, and I think that, again, is just a great reminder and a great way for us to kind of wrap up today to remember that, PTSD can affect anybody.
Yeah.
And it can affect everybody in the family, and especially when we're dealing with a special needs family. While, it may be a higher probability of being the actual individual with special needs to have the PTSD, it's also a great chance to have the parents experience because of everything they're going through, trying to get everything done. And then the sibling. This is a great reminder that we can't forget the siblings, because siblings, bottom line, they don't have a normal life.
No.
Their life is completely different than what most siblings' lives are like. And so we need to take that into account and remember that. And so a lot of these examples we gave of what you would see would be the exact same thing you'd be looking for in a sibling. There's no difference.
Because again, that sibling has no control. They're given no control over it. And that, I think, is a very traumatic place to live, where you have no control.
Right. Well, Jolene, we're coming to the top of the hour here. Need to wrap up. Enjoyed our time. Just any parting thoughts you'd like to, send out to our families, to ministry leaders on this topic and thinking through things. And then also let them know how they can get your book.
Sure. The ending thought I want to leave you with is that while PTSD and trauma are rampant and serious, the good news is it's highly treatable. And the younger you start getting treatment for children who have experienced significant trauma, the more completely they are going to recover from it, and the more fulfilling and happy lives they're going to have, because their brains aren't going to get stuck in all these behaviors that they develop to deal with the trauma. So early treatment is crucial. If you think your child is dealing with trauma, I would be seeing about getting a therapist. And I think that's important for educators and pastors and special needs ministry people to know, so that they can tell parents frequently, if you're dealing with this, you might look at a therapist, because it's going to take a lot of touches and a lot of times for that parent to hear it before they're going to move forward, because it's a hard thing to think about.
Right.
And you can get a hold of me at my website, as I mentioned, differentdream.com. Go there. If you type PTSD or trauma in the space bar or in the search bar, you're going to get all sorts of articles there. And you can contact me through that also. My books are available on order from bookstores. You can also get them through Amazon. And at my website, if you go to the section that says, I think, books, all of them are listed there, so you can find them.
Yeah. So again, Jolene, thank you so much. It's been a great topic. I think we could continue talking for a good while on this, but great information. And again, something that we just don't talk enough about. And so thank you so much for standing up, sharing your story and your son's story, and just helping educate families. And hopefully we're going to be able to help families get healthy and prevent future trauma and future PTSD by being smarter and being more aware of things. So thank you so much. Enjoyed having you here today. Next week, our Talk with Doc. Looking forward to that. Another friend is going to be coming. It's going to be Tiffany Crow. She's a behavior analyst and therapist coming in. And we're going to be talking on buckling down on behavior at home. So it's perfect timing where a lot of us are still at home. School may be postponed a little bit. I know here in the state of Kansas, we're told schools won't start until after Labor Day now yet. So we've got a few more weeks with that. But dealing with behavior at home, how to recognize behavior, how to interact with it, how to work with that. And I know that is something that every parent can deal with, whether you've got a child with special needs or not. So make sure you tune in next week, the 24th, for that. It'll be a great time. Again, if you enjoy these, I encourage you to help partner with us. You can go to soarspecialneeds.org/donate to help sponsor us financially to continue these. But thank you again for coming out. Jolene, it's been an absolute joy and wonderful information. Thank you so much, and look forward to having you at our Wonderfully Made conference coming up in October. So,
yep. Thanks so much for having me.